Thank you for this opportunity to share information from South Africa. And overall, what worries us is that we have a system in place to look at reinfections. So we monitor using our testing database, a database that has PCR and antigen tests for the whole country, both the public and the private sector. We monitor the first test, and then we can see the other tests as they come in, and we call a reinfection another test from the same individual 90 days after the first positive test. We monitor these reinfections for the Beta and for the Delta wave, and we didn't see an increase in reinfections over and above what we expect when the force of infection changes, when the wave stops. However, we are seeing an increase for Omicron. And that sort of speaks to the fact that in our population with a high seroprevalence, so where many people have had previous infection, we believe that that previous infection does not provide them protection from infection due to Omicron. It, however, hopefully provides them with protection against severe disease, hospital admissions, and death. So I think that's the first message, and data are becoming available, are being released by the NICD and will be shared, trying to show these preliminary analyses, trying to understand Omicron in the country. But I think that's the first message, and people talk about increased transmissibility, but I think in this case, this virus might be as transmissible, its own characteristics, the virus characteristics may be very similar or slightly less than Delta in spreading or being able to be contagious. However, it's the susceptibility of the population that is greater now, because previous infection used to protect against Delta, and now with Omicron, it doesn't seem to be the case. We believe that vaccines will still, however, protect against severe disease, because we've seen this decrease in protection using vaccines with the other variants, but the vaccines have always held out to prevent severe disease and admission into hospitals and death. And that's the reason why our final message really about this variant is to consider the basic principles of what we should be doing. We should be vaccinating as many people as we can so that they can have vaccine-induced protection. In addition, we should be using our non-pharmaceutical interventions, trying to remember to use masks, to use the fresh air that we have and ventilation, and to prevent and to avoid gatherings of large numbers of people in unventilated spaces.